Breathless will answer. Although he is not the moderator. My question is very simple. Agreed. The sepsis management. Did he survive?
Yes, sir.
Because the amount of whiteout was very shocking. You know, in 2 days, just few infiltration has completely invaginated the entire lungs. Everything, entire lungs were affected, one side of lungs. Unless it was the first thing it comes to mind, could it be a variant of COVID? Okay, sir will answer. Okay, no. COVID. No, we have thought about he's a known case of diabetes, got come with the infection, or with dysregulation of immunology and coming out with excess of cytokines causing sepsis. Fine, this theory is agreed. At one place, she's told that C-reactive protein has increased in that urachal C-reactive protein. And in the last one slide, you show about the levels of the procalcitonin. Okay, these are the biomarkers to be definitely followed when you are treating a sepsis case. C-reactive protein and procalcitonin. It's a very confusing. Firstly, to put a diagnosis in this case is sepsis is next to impossible, unless you are very lucky. It's a vague thing. Anything can produce that kind of symptom with initial. Suppose the immunity is less, or genetically you're born to some reacting with the infection of any, even parasitic infection, virus or fungi. Even fungi can produce this kind of response here, especially in case of diabetic patient or immunosuppressed. Agree. Now, the first thing, like in surviving sepsis campaign or the bundles, first bundle, the first sir, she said that in the first sir itself, you have to give 30 ml per kg body weight crystallized and check for the serum lactate level, which has to be more than 2 millimole per or more than 3. Did you see this thing? Lactate level, did you go for that? Okay. Did you go for procalcitonin level? That you are not. That is what I was asking. I wanted to know, sir, especially you, sir, you must be reading a lot. Are we doing any research on the latest methodology? Like any sepsis or any other disease for that matter will produce fever, breathlessness, difficulty of breathing, and confusion. This is common in any other infection. How can we say this is sepsis? You have to give strong antibiotic in the first hour. Agreed. Everybody knows what is the first hour to be done in sepsis. But how to point out that this is a case which is going to go for sepsis? That's the big dilemma. How can you say, unless you know C-reactive protein is elevated, cytokines are going out of disproportionately high, or procalcitonin is very high, or as well as serum lactate level is very high. How do you come to the diagnosis? Are we doing any biomarkers or the latest research work where we can pinpoint this is the case of likely going to sepsis? Do we have something going on, sir?